Hi, my name is Asia Rodriguez. I'm a licensed therapist and the owner of Zola Counseling Solutions based in DC. We also service clients in Maryland. Today I'm going to answer some questions about therapy. A lot of people have been reaching out to me and asking me questions about like the general therapy process, how to get started with therapy, how do you find the right therapist, how do you pay for it, how do you afford it, things like that. So I want to make sure I answer all those questions today so that you don't have any barriers to getting started. Stay tuned. Okay, so why should you consider therapy? Therapy has a lot of different advantages. A lot of people who may not have had family members who experienced therapy or just never really been a part of the therapy process at all may be wondering, why would I want to talk to a stranger about my problems? But I think what's important to recognize is that this stranger is specifically trained to deal with the challenges that you're presenting. Compared to your friends or your family members, this person is going to be able to provide a non-judgment zone and provide an objective space, which pretty much means they're not going to use their own emotions about you and their own feelings about whatever situation you have going on to support you, but rather they're going to use actual professional advice to support you. A lot of times our friends are going to say and advise on things based on their emotions about you. But what's more important is that you have someone that is there to be able to provide a more sound response, really give you that space to process and make sense of things, understand what might need a little further exploration, and most likely your therapist will have done a lot of extensive training or research on whatever topic at hand, especially if that's something that they specialize in. So you want to have someone that has a professional perspective about this, and not just your friends and family that may have never experienced this before, may have never been exposed to your situations before, or just may not really be able to give you sound advice because they're going to give you advice based on their own understanding. So the next question that I have is, where do I find a therapist? There are lots of places to look for a therapist that might be a good fit for you. I can recommend a couple of different websites and I'll put them down in the description box as well. But one thing I think is important is really kind of figuring out or narrowing down what the specific things you might want to work on are. A lot of people have a lot of different things that they're wanting to work through and process, and that's perfectly fine. I think what's also important is if you have some very specific things that you're wanting to work through, you may want to find a provider that specializes in those things. For instance, I'm a trauma therapist and I focus on domestic violence and sexual assault survivors. However, I'm trained in a lot of different things, so I can treat anxiety and depression and things like that, but I have a lot of extensive training working with that population. So if you have something specific, I'd encourage you to look for a provider that has that specific training. For instance, if you're transgender and you're looking for someone and you have some issues that are specific to the LGBT community, things like that, I would encourage you to look for a provider that might have more advanced training or experience working with that population or those specific challenges, just so that you're getting what you really need from that process. But most therapists are generally trained to treat anxiety, depression, and those kind of websites where you might find a provider. They're going to be Psychology Today, Therapy for Black Girls, Black Female Therapists, Therapy Den, Good Therapy, Therapy Tribe. There are literally tons of websites. If you type in on Google Therapist Directory, you'll probably come up with quite a few, but I'm going to list my top faves in the description box below. What you'll want to do is you'll either want to narrow it down by the specific things that they might specialize in. Maybe you'll want to narrow it down by whether or not they accept your health insurance. So if you could use your insurance to pay for sessions. You can also narrow it down by male or female provider, things like that, and their location. And then if you think that maybe you want to do video sessions with the provider, you could also do that as well. So really just narrowing down as much as possible in those directories to really find a therapist that might potentially be a good fit for you. Paying for therapy. The golden question here is, how can I afford therapy? If you look at a lot of therapist websites, they usually put their rates per session. Some therapists choose to break down their sessions by 45-minute sessions or an hour. If they do family therapy or couples therapy, they'll also break down their rates as well. And those are usually your standard private pay cash rates or card rates. However, there are other options to paying for therapy. Now, every therapist is entitled to accept whatever form of payment they choose to accept. So it's important to recognize and not get frustrated if you see that maybe you have a certain insurance and you can't find many providers that accept that insurance. Many providers choose not to accept insurance for a variety of reasons, but we'll talk a little bit about the options. Okay, so one option I want to talk about is cash pay, private pay. So private pay has a lot of advantages to you, although it may be more pricey to your wallet. So let's say, for instance, a therapist has a fee of $150 per session. You'd be paying that $150 out of pocket. However, your therapist wouldn't have to submit any paperwork to your insurance company. They wouldn't have to necessarily provide a diagnosis. They wouldn't have to do a couple of different things. So you have an extra added layer of security and confidentiality when you're just paying privately. People who probably would benefit from that most are people who maybe have security clearances or have jobs where they don't want people to know that they're in therapy or whatever else. And I think, it's a personal choice really of whether or not you want certain things on file for you, but it's important to consider that though it can be a sticker shock because you notice the price and you're like, how can I afford that on a regular basis? It has many advantages to it. Another option would be using your health insurance. Using your health insurance may be an option if you know that one, maybe you're paying a lot of money for your health insurance every month or coming out of your paycheck every month. But two, if you do have mental health coverage, you might have a really good deal. So you might have a $10 copay or no copay or whatever else, and that's what you would be paying for each visit. One thing that's important to note, however, with health insurance is that if you do have a deductible, you may have to be paying that contracted rate with your provider every session. So what that means is, let's say your therapist contracted rate with your insurance company is $150. You'd be responsible for paying that $150 per session until you meet your deductible. So a lot of health insurance plans have high deductibles. They might have thousands of dollars worth of a deductible, which means that you'd be paying that rate until you met that deductible, which means it could be a long time before you actually meet that deductible. However, there are advantages to doing so in that there's also, because that's a part of your health insurance, you would probably meet that deductible quicker if you're also going to doctor's appointments and things like that and having to do the same. So if you decide to use your health insurance, what I would encourage you to do is go to your health insurance, call your health insurance first, let them know that you're looking for a mental health provider, that you're wanting to understand your copay, want to understand whether or not you have deductible that needs to be met first, and then whether or not the provider that you're potentially interested in is in network. So the key here is in network provider. You can see an out of network provider, but that might mean that you'd pay a little bit more out of pocket or that you might have to submit for reimbursement after the fact. But if you're in network, then you're more likely to have a better rate or just pay your copay, things like that. So you'll want to make sure you're aware of what your copay is. It can range from anywhere to $0 to most of the contracted rate. But that kind of gives you a better deal, especially if you know that you're wanting to or going to need to be in therapy for a little while. It might be more beneficial for you financially. And if you know that financially you might not be able to afford a therapist's full rate, if they accept insurance, that might be a viable option for you. The next option would be the flexible spending account and health savings account, also known as an FSA or HSA account. A lot of employers offer these accounts, and they're usually in the form of like a debit card, or they will tell you to make the payment out of your own pocket and then they'll reimburse you for the expense. These plans are usually employer specific. They might be that you're funding the plan with pre-tax dollars, or they might be that your employer has agreed to put X amount of dollars onto this card already so that you can use it for your out-of-pocket health expenses. The good thing is that therapy is a qualified health expense. So if you know that you're wanting to see a provider, you could use it for their private pay rate, or you could choose to use it for their if they accept your health insurance but there's a copay or you're having to pay towards your deductible, you could use it for that as well. And so I always tell people that because a lot of millennials are not really aware of how beneficial the FSA or HSA card could be. But it's really nice, especially if your employer is contributing dollars to it every year or every benefit year. And so if you do have that, I would look into it, or if you're not really sure, I would look into it. And then, you know, if you have a designated amount, then I'd encourage you to use that first before actually paying your out of pocket, out of your own pocket, so that you can actually save money and still get the support that you need. Second, to talk about special programs. So there are some special programs out there that were created for people to have access to therapy who otherwise might not be able to access it. So for instance, the Taraji P. Henson Foundation, I can't remember the name of it off the top of my head, I'll put it in the description below, but they have a program where they're offering therapy to a specific population for a limited amount of time. There's also programs like Open Path, which I'll also put in the description box below, which has a directory of therapists who agree to offer their fee at offer their services at a reduced rate for X amount of time, based on financial need. And so there are tons of programs out there. There's even pro bono projects where there are therapists who will provide the service for free. So really, if you're really wanting it and you're really passionate about it, but your finances just won't allow you to pay for therapy or pay standard rates for therapy, I'd encourage you to look into those programs so you can learn more information about how to really find what you're needing and get what you're needing at a reduced. Okay, so I hope that answers some of your basic questions about therapy. Let me know what other questions you might have about therapy, about the therapy process, about just any general questions about therapy, and I'd be happy to answer them in another video.